Hi, good evening. Austin Mayor Steve Adler. Got a minute? We're going to go. It's Tuesday, heavy data day with the slides with Dr. Escott. So we'll get to those so that we can move through it pretty quickly. Let's begin with the dashboards that we start with. First, the key indicators for staging. Notice that the new admissions is at 24. That's down below the 7-day moving average, which is 28. Yesterday, the 7-day moving average was up at 29. So it's dropped down to 28. We're still right on that cusp between orange stage 4 and yellow stage 3. We were at 27 just a few days ago, lost that. It went up to 29. So that's some measure of we just don't really know. Dr. Escott was hoping to go down, I think, to the yellow range here and take us to stage 3. But for reasons we'll discuss in a second, he declined to do that today, although we're still in that cusp area and he's looking at it. Number of new cases today, 113. The 7-day moving average is 110. So we're above that. Indicates kind of a plateauing of numbers. And that seemed to be kind of the thrust of what we were hearing from Dr. Escott when he presented to the City Council and to the Commissioner's Court today. Let's go ahead and take a look at the other main slide that we take a look at, the other dashboard for us to see. You can see here that the number of cases just under 77,000, deaths 772. That's up 6 from yesterday. Yesterday we had gone up 0 from the period before, but today 6, still dangerous disease. Notice that the number of folks hospitalized today, 220. That's close to, but underneath the 7-day moving average of 229. ICUs, 72. But the number of folks that's the number of folks in the ICU, 72. The 7-day moving average is 71. So it's just above that 7-day moving average. Again, a kind of a plateauing. Ventilators is down. 7-day moving average is 50. We're at 43. When we have a day when a lot of people have passed away, oftentimes that ventilator number takes a dip. Let's go ahead and take a look at Dr. Escott's slides so that we can take a look at that data. We'll run through those pretty quickly. Dr. Escott's slides, let's pull them up. Today, March 9th, 2021. These are Dr. Escott's slides. Number of new confirmed cases has generally been going down. Number of new admissions in the hospital, which of course was the key factor that we've always taken a look at. You can see over on the right-hand side here that we were headed down, and now actually it looks like it's up a little bit, but Dr. Escott called that kind of a plateauing place. Let's hope it's not going up. Let's hope that it's plateauing. Same kind of plateau we see ventilators, ICUs and ventilators, that kind of plateauing. Because the numbers have started to kind of plateau instead of heading down, here is the University of Texas numbers. We looked at these here recently. We've seen those numbers heading down on the right-hand side, which are the projections that we have, but you can see it's kind of flattened out as we look toward the future. Number of hospitalizations heading down but flatter, ICUs down but flatter. It was for those reasons and some reticence, Dr. Escott, with the governor's order, not knowing who was going to continue to wear masks, knowing how important he thinks that is. People wearing masks, to opening up schools to more and more students in person and being able to keep businesses open. Don't know what's going to happen tomorrow, 2 days before spring break, with bars potentially opening. Some uncertainty with respect to whether you should wear masks or wear past masks, or whether masks work. Unfortunate, we think the governor's order adds confusion. I'll talk about our order here in just a second and what the law is. We believe in the city. We'll get to that, but it reflects the opinion and advice, and recommendation, and rules promulgated by Dr. Escott. And I'll walk you through how we got to that place and how long we've been following Dr. Escott's rules, because it's been some time. Here is hospitalizations by age group. This is percentages. Remember, we used to have the four top age groups, the three middle age groups, and then the youngest folks. Really three distinct groups by percentage, with the ones most at risk, the older folks. You can see here now there's been kind of a merging of the oldest age groups with the middle age groups. Again, this is not absolute number chart, but just a chart that recognizes the percentage. So as we get more and more vaccinations into people that are older, they represent a lower percentage of hospitalization. So that percentage comes down. Even if everything else stays the same, if that percentage is coming down, then the percentage of the other ones need to be going up. Here is the actual numbers, and you can see oldest folks, 54, 39, 34. We're at 32 here. There was a week when we had a especially low number, but generally speaking, you can see the trend downward for folks over 80. 70, 60, now down to 34, folks 70 to 79, 59, 55, 34, down to 22 for folks 60 to 69. And then folks 50 to 59, not in the target eligible group for vaccines, although we know that some folks are, 53 to 36, so it's going down, not as much in kind of absolute numbers. Even younger folks, 40 to 49, going down. See the numbers generally going down. We get to 30 to 39, numbers staying roughly the same, 21, 26, 23. 20 to 29, we have here 26, 16, we're at 21, 20, 21 in that area. Looking again at percentages, hospitalizations, but now looking at by race and ethnicity. Number for white, not Hispanic, is the highest percentage. Fairly flat over time, going back up. Hispanic was heading up, had for a long time it's been under the population for white, non-Hispanic. It crossed over that last week, but back down below it this week at 41.8% in the Hispanic community. African American numbers, we were concerned were going up, have now come back down to 11% of the total numbers. Let's take a look at that same race and ethnicity now, but looking at the actual numbers, not percentages. And you can see Hispanic, all races in green, 133, working its way down to 76. White, not Hispanic, 128, 122, working its way down to 79. African American, black, not Hispanic, 36, 28, working its way down to 20. So the absolute numbers are going down. This is an important chart. This is positivity. Remember, we're trying to get below 3%. We got as high as 16.7, 16.3 as we were exiting last year, entering this year, down to 4.6%, below 5%. That's a really good number for us to have. Last week, remember, it was 6.9%. The week before that, 10.3%. Looking at positivity, but this time based on race and ethnicity. You can see again, we're trying to get below the 5 line, actually to try to get below the 3 line, which is the red line that we're seeing. And you can see that the Asian population below that 3% number. The other category, which is relatively few numbers. White population has gotten below 5. The Black African American population gotten just below 5. The Hispanic population is now below 10. It's been going down, but still greater than 5. But you can see overall positivity is heading down, and we have more groups that are getting to a better place. This is positivity by age. And you can see older folks numbers continue to go down in positivity. We have this anomaly that we saw a second ago for folks that were 80 and over. The numbers getting smaller in the universe, but generally speaking, you can see positivity is going down. That's a good sign. It was because Dr. Escott was looking at positivity going down that he really wanted to take us into that stage 3 yellow stage. But the fact that it looks like we may be plateauing out, he wants several more days to take a look at it. We don't tell him what to do or rush him. He is totally focused on the data and the doctors. And it's good to have somebody who is apolitical in that role, giving our community his advice and guidance, and somebody that is setting rules designed to keep us safe. Here's the positivity numbers for schools: high school, middle school, elementary school, and preschool. So the numbers generally going down. This is long-term care facilities. Cases within the last 14 days, only 10 cases. Only 10 cases. I mean, this number was many multiples of that not that long ago. Only 36 cases in the last 28 days. I'm looking at a page here. This is what? Middle of February, it's the 18th, so just a couple weeks ago. In the 28 days prior to that, there was 189 cases. So now we're down to 36 cases in the last 28 days. That's because both the federal government, state government, and locally, we really did focus on the people that were ending up with really serious complications in our hospitals, or people that were passing away. Trying to get them vaccinated early, and we're seeing the result of that. Numbers are getting low enough that we're probably going to take to just a warm status. The alternate care site and the convention center stand it down because there's the excess room in the hospitals now. This is the virus, the influenza. Congratulations to our city keeping this number below 2%. In the past years, when we saw numbers go up higher and a lot of illnesses, we've worn masks in those prior years and socially distanced, we would have seen numbers down here. We didn't do it for flu before. This is the stages. We're still in stage 4. Dr. Escott wants to take us to stage 3, is leery of doing that. Really wants to see and make sure that people are wearing masks, that businesses are requiring masks of their customers. He is just believes that to be so important for us to be doing. Director Hayden pointed out that now on Austin Public Health, they're giving out the appointments on Monday for the appointments that week, rather than doing it 2 days, 2 different days to sign up. That way you know early in the week whether you have an appointment or not and when it is. When you go onto the site now and get in the queue, it'll tell you what number you are, and you can get a feel for whether or not you're going to be able to make it or not. As of March 6th, Austin Public Health had given out 113,000 vaccinations. On top of that number, at COTA, they gave out another 10,000 this past weekend. I think they have 14,000 to give this week. So this number here, it has an additional 25,000 from COTA that could be added. But remember, there are another 300 and some odd providers in our community. So there have been about 300,000 total vaccines that have been given out in our area. We don't have visibility for the ones that are being given out by the drugstores and the like. We don't see that. We don't see that data. We have the capacity to go to 37,000 a week with our existing operations. If only we would be able to get that measure of supply. We're focusing on teachers and school officials, child care workers, and the like. We do Saturdays where we're focused on schools. Austin Public Health is the operation out of Coda. It's going to do the same kind of thing. But at this point, APH, Austin Public Health, has done about 5,500 school staff total. I think that Travis County has done another 1,000 plus, about 2,168 child care staff. Also, that's just Austin Public Health. So obviously more senior population, 70,000 of the seniors vaccinated over 65. That's just, again, Austin Public Health. Mass vaccination operation strategy. We could increase the number of days we do it the week. We could increase the hours that we have. There's a cost association with staffing that up. But it would take us about 8 weeks to vaccinate everybody. If we got all the vaccine we could possibly handle, I don't think it's going to happen that way. But we're not the only ones that are giving out the vaccine. As a matter of fact, there's 200-300 other providers are giving out vaccinations. If they continue to do that, then without having that kind of expansion, just staying with the kind of operation we have now, hoping that we get even more to do, we can do with the existing operations that we have, and still get vaccinations out to the whole community. This is not a choice we get to make. The federal government and the state are issuing their allotments. And I think that the best guess is that they're going to not just give it to Austin Public Health and to Travis County, but also push it out through drugstores and grocery stores and the clinics and the like. So that's probably what we're going to see. But if that ever changes and we're focused on a big hub operation, we're ready to go ahead and to get that done. There was some news that happened today with respect to the let me get out of this, the order. The judge, the governor issued his order under Section 418 of the Health and Safety State Code. That he says trumps the mayor's order, the county judge's order. Whether it does trump or not is something that was raised in the courts on New Year's Eve and is still being handled in the courts. But we've made the decision here locally not to try to assert my order or the judge's order. We're just going to let that court issue get resolved. Based on the case rising from New Year's Eve. So we're not going to push for the enforcement of our orders. But Dr. Escott has his own rules. Last July, when the governor was indicating that the local government should use all of the powers available to them to enforce the rules that were recommended by science. We gave as a city, as we are allowed to do under state law, which gives cities the ability, and counties, the ability to be able to adopt. It says the governing body of a municipality or the commissioner's court of a county may enforce any law reasonably necessary to protect the public health. That is an entirely different set of laws than the ones that relate to emergency orders that relate to what the governor has been doing and what we did. That's an independent basis. So based on that statute last July, the city council said to Dr. Escott, would you please promulgate rules based on the science and the data, and whatever rules that you promulgate, we're going to give the force of law. We passed that ordinance back in July. When we did that, I got a letter from Governor Abbott. It was addressed to me, dear Mayor Adler. The City of Austin's consideration of additional enforcement mechanisms to ensure compliance with my executive orders is an important step toward reducing the spread of the novel coronavirus, COVID-19. As you know, these orders were created and adopted based on advice from medical experts. And if these orders are followed, we'll be able to protect both public health and the livelihood of our citizens. Taking steps to ensure compliance with these orders, as the city is contemplating, is necessary to protect public health and safety and will reduce the spread of COVID-19. Sincerely, Greg Abbott, Governor. So that's what we did, is we passed an ordinance consistent with the code to give the rules of Dr. Escott the force of law. In December, that ordinance was expiring, and we extended it through this calendar year. Also in December, Dr. Escott revised and reissued his rules. I'm not sure if there were any real changes in them or not. But his rules since last summer have had the force of law here in Austin, and has had the force of law. So today, we didn't change anything here in this city. We announced that we were not going to enforce my order, but when our health authority comes to us and says these are the rules that he believes the data and the doctors require for us to be safe, then really the City Council has no alternative but to support that apolitical, scientific, data-driven response from our health experts. Just so happens that his recommendations coincide with the recommendations of physicians and doctors and data virtually around the country, including the CDC. So his rules that have been in place now for some time say that people should be wearing masks, makes that mandatory, and says that businesses should require masks, makes that mandatory. So that's the law in Austin. Now, by way of enforcement, I got asked that question today. You know, are you entitled to enforce it? The answer is yes. It's a Class C misdemeanor to violate a rule of the health authority that has the force of law. But remember what we've said since March of last year. We can't enforce our way to compliance. There are not enough police officers or deputy sheriffs or code enforcement agents. It's got to be something that we want to do. It has to be part of our culture. We do have rules and orders on the book, and we can enforce them. But obviously, it's been our policy and practice to lead with education. That's what we've been doing for a full year now. Enforcing only in most egregious cases, and I don't expect anything to change. I will say that I have been really encouraged, and I'm real supportive of all the people that have said that they were going to wear masks, all the businesses that have said they're going to require masks in their business establishments. And I'm just real appreciative of that, because at the end of the day, bottom line is that, you know, we should be wearing masks, not because of anything that has to do with law. We should be wearing masks because it's the right thing to do. We are so close right now, so close to seeing the light at the end of the tunnel. If we can just keep the numbers down, we can continue to open things up. Dr. Escott will get us into stage 3 yellow, and then he'll move us even past stage 3 yellow to stage blue to 2. If we can just keep pulling down these numbers, it increases the number of children that will be in person in school. It increases the way we can really open up businesses without any threat of any backsliding. That's really the motivation that people should be focused on. And I hope that as a community, that's what we see, and that's what happens. So today we didn't change anything, but we just did reaffirm that even though we're not enforcing the mayor's order, insofar as it conflicts with the governor's order, under a completely different legal line, we are going to continue to follow the direction and hold to be enforceable the rules as promulgated by the health authority. That being the case, we're going to continue to ask the city here to mask up Boston. All right, that's all we have for tonight. You all take care and be safe.